All right, we're now approaching the last chapter of pharmacology. Can you believe it? Chapter 12. It concerns anti-inflammatory, anti-arthritis, and anti-gout drugs. So basically, we're going to be talking about medications that will benefit the musculoskeletal system. So textbook pages 225 to 239, and then your ATI chapters 28 to 30. So we'll be talking about NSAIDs some more, including aspirin. And then we're going to get into talking about various disease-modifying drugs for more severe cases of arthritis, like rheumatoid arthritis, and osteoarthritis that doesn't respond to regular treatments. And then we'll learn about gout, which is delightful. All right, so as you can remember, way back in anatomy and physiology, you studied the musculoskeletal system and you memorized some of the muscles. There is a lot to cover in the musculoskeletal system. And we started on page 225 in the textbook. And you've got to think about bones, joints, muscles. We have tendons, which attach muscles to bone, and then ligaments, which attach bones to each other inside the body and kind of keep the joint stable. So there are a lot of structures there, a lot of hardware that can get injured temporarily or permanently. So we're going to be talking about some anti-inflammatory and analgesic drugs that hopefully will take care of more mild pain. We talked a little bit about skeletal muscle relaxants. I can't remember if we talk about them again in this chapter. Then drugs for arthritis and drugs to treat gout. There are about 100 different types of arthritis out there. There is a lot. But we're going to talk about the two kinds that you're going to see more often, osteoarthritis and then rheumatoid arthritis. So the first thing that we need to look at is the inflammatory response. And an inflammatory response is any trigger to inflammation. It can be stress on a particular body part, either a lot of stress at one time or repetitive stress day after day after day. Specific injury, like sports injuries. Infectious agents. You know that when you get sick, if you've got a fairly severe viral or bacterial infection and you run a fever, you tend to ache all over in the muscles and joints. Ischemia, a lack of oxygen to a muscle, causes cell death and excruciating pain. And any kind of antigen-antibody interaction where your body's trying to fight off an antigen. That's why sometimes after you get immunizations, get a routine flu shot, you kind of ache for a day or so. Doesn't mean you're sick. It's just your body is mounting a defense against that antigen that was introduced, and it's setting up antibodies. On page 225, we talk about the phases of the inflammatory response. And you can see a picture on page 226. But the main symptoms of inflammation that you're going to see are going to be pain, redness in the area, usually some warmth as blood cells rush to that area, swelling, and eventually, if the injury is severe enough, or if it's a repetitive injury, you're going to see a lack of function to that part of the body. You see that with arthritis, where a joint repeatedly is irritated, forms an inflammatory response, swells, and then goes down again. Eventually, over a period of time, there's going to be damage to that joint. Now, here I have an animation of the inflammatory process, and I won't bring it up here, but you can go ahead and copy and paste this link, and it will show you the various stages of inflammation. You're going to see vasodilation at the site of the injury so that the body can rush inflammatory cells, red blood cells, white blood cells of various kinds. Other inflammatory mediators are going to rush toward that spot, and the warmth and swelling and redness is going to result from the rush of all those chemicals to the body. And I kind of compare the response with that of a traffic accident. You've got your first responders, you've got police, fire, ambulance that shows up to treat the real problems right there, and they either say it's okay for everybody to go, or they take people to the hospital where the healing continues. And then we have a secondary response. You've got cleanup crews that come. You've got, Tennessee Department of Transportation trucks that come and clean up the structure and kind of get things back to normal, sweep up broken glass. And that's what you have after an inflammatory response. You have some cells that are going to show up to clean up that area. And along the way, we end up with a variety of chemicals that come to that area. Cytokines, there's histamine usually that causes that vasodilation and that initial swelling. And then prostaglandins. Prostaglandins are tissue hormones. They're considered to be both helpful and harmful depending on what is going on. And they are particularly helpful to functions of the circulatory and the digestive system. On page 225, we talk about a substance called cyclooxygenase 1 and cyclooxygenase 2. And of course, whenever you have a substance that's labeled 1, you know that there's enzyme function that leads to a 2 right around the corner. So we're just going to call them COX-1 and COX-2. And COX-1 and COX-2 kind of work inside the body to control the actions of prostaglandins. So if you limit the action of a prostaglandin, eventually you're going to limit the way COX-1 is able to turn to COX-2 and control prostaglandins. And we see this function in one particular class of drug called the cyclooxygenase 2 inhibitors, or COX-2 inhibitors. And you can see them listed on page 228. And they list Mobic. Mobic is many times just considered to be another NSAID. But the one that's mainly sold now is a drug called Celebrex. And you still will see the advertisement for that. That one about a body in motion tends to remain in motion. So celecoxib is the generic name, and then Celebrex is the leading seller from the COX-2 inhibitors. At one time, there were several other COX-2 inhibitors that were introduced, and they did a super job, really did a great job of taking care of arthritis pain. One was called Vioxx, did a really, really good job, but because it controlled the actions of prostaglandins, and prostaglandins can benefit the circulatory system by blocking those prostaglandins, it caused some heart symptoms and heart failure in a small number of people who tried some of these COX-2 inhibitors. And the problem in some cases was not that it caused these side effects, that was bad enough, but the companies were sort of slow to respond to those reports, and they got a lot of bad publicity. And you'll still see some commercials for legal representation for people who took Vioxx, for example. So Celebrex is the main COX-2 inhibitor that is still out on the market. And you can kind of read about that at the bottom of page 226.